Hi everyone, welcome to my YouTube channel. This is Odeya Longwan. Today we are going to go through renal failure, which is a medical condition. The scenario of this question reads: Miss Chande Shalom, a 26-year-old university student in the School of Humanities, is brought to your female medical ward and has a history of reduced urine output, nausea and vomiting with weight gain, and upon admission, a diagnosis of acute renal failure is made. He is supposed to write his final examination in 2 weeks' time. The first question is saying define renal failure. The second one is saying explain 3 classification of the causes of acute renal failure. Then the third one is saying outline the 4 phases of acute renal failure. The last one is saying describe the management of renal failure under the following: medical management and the nursing care. So without wasting our time, let's start answering. So the first one is saying define renal failure. So as we know, when defining any medical condition, it should have include the system it is affecting, the cause, and also the signs and symptoms. In our scenario, they have included signs and symptoms for us, making our work very easy. So, renal failure, this is simply a medical condition which is affecting the urinary system, and there is inability of the kidney to excrete waste materials from the body. Those waste materials can be concentrated urine in other components, and it is characterized by it can be reduced urine output, nausea and vomiting, and there is also weight gain. Yes, that's the definition for renal failure. Then on B, it's saying explain 3 classification of the causes of acute renal failure. So the causes of acute renal failure or renal failure itself is classified into 3. We have what we call pre-renal causes. Then we also have what we are calling intrinsic or intrarenal causes. Then lastly, we have what we are calling post-renal causes. When we talk about pre-renal causes, we are actually talking about any damage, trauma, or injury affecting any organ before the urinary system starts. It can be the liver, the heart. Yes. So once there is reduction to renal blood flow, this may lead to fluid deprivation. Once that is there will be renal failure. The kidney won't be able to excrete waste because of reduced renal blood flow. Then impaired cardiac performance, it will lead to decreased cardiac output, which will cause myocardial infarction. Then when we talk of intrarenal causes, we are actually talking about the causes or the impacts affecting the urinary system itself. It can be any condition you can think of. It can be nephritis, nephrotic syndrome, kidney stones such as urethritis. All those can lead to renal failure. Then the last one we have post-renal causes. This includes any damage, trauma to the organs after the urinary system. So an example of these organs, you can give an example of benign prostate hypertrophy. Such damages or trauma to heat to such organs just after the urinary system can lead to what we are calling renal failure. Then the next question, which is on C, we'll end on it. It's saying outline the 4 phases of acute renal failure. So in acute renal failure, it begins with the underlying climatic condition which leads to changes in the kidneys. Yes. So the first stage is what we are calling initiating phase. So this begins at the time of the problem, and it continues until the signs and symptoms become apparent. Then the second one is what we are calling origolic phase, which follows this initiating phase, and it follows one day of the onset and duration of the initiating phase. Then the third one is what we are calling diuretic phase. This begins with the gradual increase in daily urine output, which is of 1 to 3 liters per day, and it may reach 3 to 5 liters or more per day, or it can take 2 to 6 weeks. Then the last one is what we are calling a recovery phase. So on this recovery phase, it begins with glomerular filtration rates to increase, which will push now the kidneys to excrete more waste. Yes, that's all for today. Thank you so much.